Hi, my name is Gavin Norris, and today I'll be doing a persuasive speech over why primary care is more beneficial and better suited for long-term medical care than urgent care is. So the first main reason why I believe primary care is more beneficial um, than urgent care is because it allows for a long-lasting relationship to be formed between patient and provider. So you might ask, why is this beneficial? That's a good question, and it's beneficial because it allows for the patient to trust their provider more, and it allows them to be more comfortable coming to their provider with things. Um, an article, She Knows Me Best, it mentions this. It says that patients and caregivers valued in-person follow-up with their primary care provider following discharge from hospital because of the trust established through pre-existing longitudinal relationships. So basically what that's saying is after discharge from hospitals, or patients would go to their primary care provider because they trusted them and they wanted their opinion on things. They wanted to check in with them, make sure that they agreed with exactly how their treatment was going. They were more comfortable with going to them. And you just can't get that kind of relationship with urgent care. Um, Another major reason why primary care is generally better suited than urgent care is because urgent care has a greater chance to make an error. Now, let me explain what I'm talking about here. During my interview with Kendra Norris, she mentioned the difference in volume between the two practices, primary care and urgent care. She said, in urgent care, you see a high volume of patients, typically around 60 to 80, a day with both acute and chronic conditions, focusing mostly on one problem at a visit. In primary care, you have a set schedule, averaging 20 to 30 patients a day in most clinics. So you see the difference in numbers there, upwards of 80 and upwards of 30 in both primary care and urgent care. In urgent care, you're seeing a lot more patients, which means you have a lot less time to handle each patient. But in primary care, you can devote more time to each individual patient and make sure that everything's on the up and up. You can spend more time on that patient and make sure that they are taken care of in the best of ways. Urgent care, you can't do that because you don't have time. Because while you're working on that one patient, you have many more in the waiting area that you have to get through. In the article in Inconvenient Truth, Urgent Care is Not Primary Care, it describes the things that urgent care does well. So, urgent care isn't, of course, bad in every way. However, it's not best suited like primary care is. The article states, what urgent care centers do so well is fix what is simple to fix. Urgent care typically it's designed to treat more common illnesses, whereas primary care can handle more serious stuff, or at least can redirect you to a specialist who can handle that more severe stuff. Urgent care is mostly just whatever you come in complaining about that day, they're going to take care of that and get you out of there so they can go see a bunch more patients. Um, and the last major benefit of primary care I'll mention today is that primary care is designed to put medical illness in the term of lifetime context. So, in the article Primary Care or Choosing a Primary Care Provider, it mentions the responsibilities of a primary care provider. It says that a primary care provider teaches healthy lifestyle choices and diagnoses and treats common medical problems. It is the role of a primary care provider to make sure that their patients are following healthy lifestyles and making sure that everything is just going well for them in a lifestyle context long term. Overall, primary care providers, I believe, are better suited to treat patients in a long term kind of way. I hope this persuasive speech was interesting, and I hope you got something from it. Thank you.